So, if you are appearing for the interview anytime soon, please remember that you cannot be prepared for every single question. And this actually applies to any interview process, whether it is for your job, whether it is for selection to universities, and so on. There are some questions which you would be expected to be prepared for. These may include those you have mentioned in the personal statement, which I mentioned just before this. But apart from that, try to acquire a broader knowledge base. And what I'm going to cover in the next 30 to 40 minutes, or possibly longer, depending on how it goes, is to give you an overview of the medical aspects of it. Of course, there are many non-medical aspects. There are systems related to how the hospitals work, how team working works, leadership skills, clinical governance, how the NHS works, how you have a referral pathway, ethics of medicine. So there are so many different aspects. Communication skills will always be an important aspect. Team working will be an important aspect. Multidisciplinary care. So you should be prepared with all these as well, which I won't be covering today, but there are a few videos on communication skills on my channel. I will add this to this playlist as well. The main important aspect is to focus on strategy. So as I said, you cannot be prepared for every single question. So you have to have a plan as to how you would approach the answer. You should try to start speaking without much of a pause. The easiest way is to give an introduction to your response, which will be a kind of repeating the question in a slightly different way, or explaining what you have understood of the question first. So this gives you an advantage of reiterating what you have listened and what you have understood. So if the examiner feels you have understood it wrong, it can be corrected before you actually start the response. It also gives you a few seconds to bring the thought process into flow. The interview assessment happens fairly quickly as you start speaking, and if it is a MMA model, you just have 5 to 6 minutes in a station. You would only see that examiner or interviewer for that short brief time. So during that time, you have to cover as much as you can. So give an overview or broadly mention the main subheadings you would be covering. So whenever a question is asked, you know what specifically you would be covering. So bring those points in the beginning and then start elaborating on any of those points, and the examiner can pick any other point as well if that interests them more. So the discussion would start after that process, but you need to really show that you're confident. You need to show your thought process is working well, and you need to show them that you have a few points that you would like to cover. There is no absolute right answer. Be relaxed and confident. The examiner looks at your approach more than what exact answer you are going to give.